Good afternoon, good afternoon. Hope everyone got some lunch. No food comas here. Sustainability and scalability, the most exciting topic of the conference. It feels fitting, it feels fitting. We're gonna go on an adventure together here. So, I'm gonna put my timer on. I can be a bit of a talker. I'll try to make sure I get everybody out of here on time. This has been an incredible adventure for us at Blue Zones Health. I've been on this adventure with the American College of Lifestyle Medicine since 2008. I had to go back and look and say, oh wow, I joined 4 years after the inception. And I was in the original class in 2017 and around the board certification. And from the beginning, we've been after this holy grail. How do we bring lifestyle medicine to the masses? So who am I? I've been around a lot, but many of you probably don't know me. I'm Dr. Kono Badalamenti. I am the Chief Clinical Officer for Blue Zones Health. I, in 2008, was a medical student that was bright-eyed and bushy-tailed and ready to change the world. I realized the same thing that many of you have. Lifestyle medicine works. If we can change our habits and focus on the evidence-based principles, and we can get others to do the same, who would we be without these nagging diseases? I want to tell you a little bit of my story, and I'll get to that, but I think it's fitting to hear from Dr. Dexter Sherney, our Chief Health Officer, a pillar in the movement of lifestyle medicine, a mentor of mine and many of yours, and he has a special message to tell us a little bit about why we're here today and the plans for Blue Zones Health. So take a look at the screens.
Hello, everyone. I'm Dr. Dexter Sherney, Chief Health Officer for Blue Zones Health and Chief Health Officer for Blue Zones. My journey in medicine began in the operating room as a surgeon, focused on fixing what was broken. Over time, I realized I wasn't addressing the root cause. I was treating the consequences of lifestyle that eroded health long before patients reached the hospital. That led me to lifestyle medicine, which completely changed how I see my role. Instead of waiting for disease, I help people now stay healthy through food, movement, purpose, connection, and community. For the past few decades, I've worked to bring that vision to life in corporations, communities, and health systems. One challenge has remained. How do I bring lifestyle medicine to scale? That's why I'm so proud of what we're building at Blue Zones Health. In many ways, this is the culmination of everything I've been working towards throughout my career. We're taking the science of lifestyle medicine and embedding it into a real-world care delivery model, one that is team-based, connected to community, and supported by an operational and economic structure that makes it viable for providers and accessible to patients everywhere. This is what it looks like when we align purpose, evidence, and infrastructure. Is lifestyle medicine becoming mainstream, integrated, reimbursed, and scalable? And it's happening through the convergence of two great movements: the Blue Zones principles that inspire healthier communities, and the lifestyle medicine framework that transforms clinical care. So here's my invitation to all of you. If you're not certified in lifestyle medicine through ACLM, now is the time. Take that step. And if you are already certified, then the next step is to join Blue Zones Health. With Blue Zones Health, you'll have the chance to practice lifestyle medicine in a model that supports you clinically, operationally, and most of all, financially. Together, we can make prevention and well-being the foundation of healthcare. Thank you. and enjoy today's discussion.
Yeah. So I'm going to do my best to bring the story that he described better than I can to life. The question he posed in that video, and he also said, I'm proud, we are working towards a solution that 2008, lifestyle medicine works. This is the best kept secret. How come not everybody's doing this? 2017, lifestyle medicine works. This is the best kept secret. How come everybody's not doing this? And why is the system working against us? Why is it so hard to figure out how to get this paid for? Why is it so hard to get everybody in this movement together so that these services are central to the healthcare system in America? His question was, how do we scale lifestyle medicine? That's still the question. And we have a proposed answer that we want to walk through. There were other questions that have been coming up, questions that I've had, questions that many of you in the audience have had. We went on a listening tour over the last year, and many of my colleagues, many of those that showed up to our booth last year at the Blue Zones booth said, how do we grow our practice? We want to do this. We want to bring it to more people. If we do it and grow, can we be sustainable? Are we going to put ourselves out of business with these codes? I've had patients, they come in. I remember when I was doing direct primary care, spent so much time in the first few months with the patient, and he said, I totally get it. I love our relationship, but why am I still paying you? I know what to do now. And it's like, well, yeah, I understand. That makes sense. If you're not going to come in, I'm not going to force you to keep paying me a monthly fee. And he did great. And so it is. But can we be sustainable as we transform our communities? And what often happens if you're siloed in your practice is you can burn out. The more time you give to a few patients, you start to run out of time. And you think, well, I really wanted to scale. I want to be able to bring this to more people. I want to spread this. Can you do it in a silo? And if you're going to bring a team together, can we make it accessible to everyone, especially with limited codes, where sometimes you put together, you learn, oh, I came to the conferences, I paid for the kits for direct primary care when I was at AAFP back in 2014. And I was like, I'm going to do shared medical appointments everywhere and anywhere. I understand the billing codes, I'm going to do it. And then comes practice. And you say, well, wait a minute. Wait, I didn't think ahead, and this is a commercial contract. And even though I can do it, these billing codes don't get me anything. I'm capitated. And then the other group, it's like, oh, I have to get a copay, and the patient doesn't want to pay a copay. And then others are in a different billing model. And it can get complicated even when you know what to do. And so the question is, how do we bring lifestyle medicine to everybody? The other challenge that I've had when it comes to scaling is if you're trying to do it by yourself, it's sometimes not as effective because you're one person in one place or you're a team in an office, and health happens in community. It happens in the life radius. That's what we've learned from the Blue Zones. And so I'd like to share a video from Blue Zones, our incredible partner, which I'm blessed and excited to be a part of, that talks about convergence, which is really what our model stems from. So take a look at the screens.
For too long, healthcare has worked in silos. Clinicians treat disease. Communities are designed for convenience, not health. And culture, too often ignored. But the silos are breaking. The future of health requires three forces working together: clinic, community, and culture. This is convergence, where care of the patient meets place-based design, meets health of the public. Without clinical rigor, we're guessing. Without community design, we're asking individuals to swim upstream. Without place-based transformation and personal inspiration, We're imposing solutions that don't fit and deepening disparities. The time for convergence is now. Convergence means more good years. For your patients, for your practice, for your community, and for yourself. Visit the Blue Zones booth at Lifestyle Medicine 2025 and experience the convergence of health.
Convergence. We're going to talk a bit about convergence. Can we make that real? Can we take the clinic and the community and bring it into the culture of our lives and transform? I feel really just in this strange milieu. I'm a dad now, so I have dad jokes, which is why I'm throwing Indiana Jones classical music at you to start. The ability to come in at this stage in my career. I started practices with Dr. Wayne Dysinger out of residency back in 2014, and we were bootstrapping. I became a compliance officer. I was reading through IPA contracts, trying to figure out, can we make this small business work? And I've been talking about Blue Zones since residency. I remember in 2015, as we were building our practice, you can look me up, I have an Ask Me Anything. I spent an entire day on Reddit trying to say, hey, let me get myself out here. We were at the Chamber of Commerce. We were putting ourselves on local magazines. Can we even be known in our backyard? And what I was so excited about was Blue Zones was such a simple, principle-based thing that was transforming lives. I would, during that AMA, say, I'm a lifestyle medicine clinician working in one of the world's blue zones where people live longer, healthier, and happier lives. And here I am now on this stage as part of Blue Zones Health, trying to ignite and take that movement and marry it, and it's not me, it's happening with this movement of the American College of Lifestyle Medicine. We have a movement. It inspires people. I don't know, has anyone seen the Netflix specials? Incredible, right? Am I wrong? Anybody? You're gonna, nothing? No love? I didn't make it. I'm just giving credit where credit's due. It's inspiring to see people that is it an NADH IV drip that is what's helping in the Okinawans? Is it the rapamycin protocol, guys? Is it the 23-year-old who's come to me and say, should I already start metformin to help my mitochondria and maybe live forever? No, that wasn't what Blue Zones brought to the table. They went and they said, what are people already doing in the communities that is leading to longevity? And then what was so powerful, what Blue Zones, the organization, did, which is why it's so exciting to partner with them, they said, we're gonna try something bold here. We're not gonna just say, oh, they're doing it. We're gonna say, can we recreate it where it's not being done? Can we come to a city like Fort Worth? Can we go to Cowtown and convince people to try to take these principles and build them into the community with the stakeholders of that community? And it turns out that works. We can get ourselves to be inspired and say, we're gonna take on this bold action. We can transform communities. And I've been coming to these ACLM conferences for some time, and what I found in my practice is if you can get individuals to take on their own morbidity and say, I'm going to make these lifestyle changes, it works. I've worked as an associate hospice director, getting people to focus on purpose and what matters. It works. I've worked with an urgent care in my trunk, taking care of the sickest and poorest patients in I live in South Carolina now, in Southern California, in Hemet, in the IE, and then also in the Mississippi Delta. And you know what lifestyle medicine does in those communities? It works. It works. But getting people to do it, getting people to sustain it, that's the magic. That's the secret sauce. And then the biggest thing, the reason why we're here today is how can we all come together and actually be reimbursed for our work? You know, so much of what we do in this healthcare system, there's a fun phrase that goes around our organization. It's, our job is not to push on a rope. But so often, I feel like that's what lifestyle medicine does in the general healthcare system. It feels like we're pushing on a rope when we're trying to do it ourselves. And so it's been, I think, 3 years ago now, Dr. Deisinger introduced me to the leaders of Blue Zone Health, and they have been in the rooms with healthcare executives, with the payers. They understand value-based care. They come from a perspective of, we know not only how to speak the language, but how to create the ROI and build the structured contracts that will be good for everybody. And so that's something to bring to the Blue Zones Health movement. That's Blue Zones Lifestyle Medicine. Can we also, without having to be the experts of all of those things, do what we do well and not push on a rope? That's what Blue Zones Health is about. And so what I want to talk about today is we've been doing this in Southern California. We have full risk, global risk that we take. But we want to come and bring this to everyone everywhere to help people live better longer. That can't happen unless we bring it to everyone everywhere. We put out a press release this morning, and you're the first to know the inside secret, which is we're expanding nationwide. We've been working on this in the background to go across the country. A globe is coming maybe one day. Right now our focus is, can we bring this across the country? Our intention is not to go alone. We want to bring everyone in the lifestyle medicine movement into a national credentialed lifestyle medicine ecosystem. So let's talk a little bit about what does that mean? What are we bringing to the table for you? We can be a central payment and payer contracting tool for our lifestyle medicine community. We credential, we privilege, we contract. What do our providers do? Focus on what you do best. Build strong relationships within your community, with each other, and then with patients, and helps transform the community you live in. And let us bring that to scale and find reimbursable ways to ensure that there's payment for everybody who's doing the hard work. So how does this opportunity come to life? We've set up tiers. You can see that there's little information sheets on your chairs. There's a QR code on it. Please don't scan it just yet. There's applications that everyone can apply to be a part of our organization. We are doing it in tiers because billing works in mysterious ways. If anyone's looked at a billing code and a claim, there's lots of nuance to it that the thought is, well, we don't have to get into all that. I'll talk at a high level, but physicians, you come with panels. You want to grow your panel. You want to be able to see if there's additional billing and have support and be able to have your services be billed with the health insurance that exists for your patients. Come, apply, join us, and we can have you be a part of our system so that we can support the contracting and the billing. If you are a licensed clinician, maybe you don't have a panel, but you say, I want to support a panel, I'm happy, I have bandwidth, come, apply. If you are a certified lifestyle professional, you're a certified health coach and nutritionist, come and apply. What if you're non-licensed? I don't have a license, but I love lifestyle medicine. I breathe this. Come and apply. What is the pathway like? Many of you have already done these steps, although the Blue Zone certification course is new. I haven't even done mine yet, but it's coming. But lifestyle medicine, if you're certified and you take the Blue Zones certificate course, you become Blue Zone certified. What can you do with that? Well, with Blue Zones Health, you can take advantage of the Blue Zones Health brand. You can get center certification. We can help support growth for your practice, and we can help integrate you with each other in a growing, focused community of experts. So I want to tell a story. So as I was preparing and thinking through, wait, when did I get board certified in lifestyle medicine? It's 2017. And I remember I was at a conference in Tucson, and there was a really wonderful talk, and it was called The Road Less Traveled. And it was from Tom Emmerich. I don't know if many of you were there or remember his talk, but He was one of the VPs for the benefits packages at Walmart. And he's part of the reason that Walmart went to a centers of excellence model. They realized that, and I was shocked listening to this on the stage. This is 2017, and my belief system about medicine has been shaped by books like Shannon Brownlee's Overtreated in America, Why Too Much Medicine Makes Us Sicker and Poorer. And so I'm a natural skeptic that you gotta show me the evidence. And he still shocked me. He said he had patients that would go and they would get a local doctor to say, you need a transplant. And then they would go to a center of excellence, and 40% of the time they would say, you know what? You were misdiagnosed. You don't even need that transplant. And I mean, even that blew my mind. I said, that can't be true. And I don't know if anyone's been close to medicine enough in different places, but of course it's true. It's hard to do all of the medicine right everywhere. And you need centers of excellence. What is this group? We are a center of excellence in the area that I spent as much time in medical school having to memorize the DR3 and the DR4 gene are associated with type 2 diabetes, more than I learned to motivational interview. And not all of the things that we learn to be medical experts with degrees start with being experts at lifestyle medicine. But it is the paramount center of excellence that's needed for this time, this here and now. And what I'd like to walk through is our care model to describe what I think will be, if we build it, the center of excellence. But as you've seen, convergence doesn't really work in the way a center of excellence surgical center will work. It can't be a brick and mortar where we all sit together. It has to be embedded in the community and the culture. And so if we're really gonna build a center of excellence, it has to be distributed, decentralized. So our model starts with the clinic. And in the convergence model, yes, you're working with a strong relationship with the patients, but there has to be a partnership. And that partnership is enveloped in the community. It takes an army. We can't go alone. And so in our model that we've been building, we have a well-being advisor. These are health coaches that support your care plan. If you're a primary care doctor, if you're a specialist, if you say, I want you to take on these pillars of lifestyle medicine and support disease states, they can go on and support that member, introduce them to other experts in the community, support a virtual prescription, a community prescription, and in between the visits when you talk to your member, you'll see the improvement because the patient has a team of experts working with them. What does that look like for a member coming in? Well, they come in sometimes through the primary care doctor. Sometimes they're referred themselves. They came to a community event. Sometimes if we're working with the health system, we might be helping with transitional care management. And they realize, oh, this is so important that this longitudinal relationship happens because that's what's gonna help get this patient to not end up readmitting. Once they've been connected, we connect them to our well-being advisor. They do an intake, and then the magic starts. Make a care offering together. What do you wanna do? What are we gonna work on first? Let's set a time to check in. Let's get you connected to different support modules in our community. Follow up with your PCP. Change the care plan again. It's rinse and repeat, rinse and repeat. If there's something that's not working, escalate internally or back to the doctor to adjust the care plan. Rinse and repeat, rinse and repeat. That's the model. So it looks fun on a slide, but it's happening in real life. This isn't just a slide and an idea. So what I'd like to do now is bring up our Blue Zones Health team. We have been doing this in Southern California, and it's one thing for me, the Chief Clinical Officer, to talk about. It's another thing to say, hey, we're doing this. Let's talk a little bit about what we do. So with that said, I'd like to bring up our team. First, Dr. Deepika Pandit. Let's give her a round of applause. Deepika is our center medical director. She's actually one of my mentors. I was an intern at Loma Linda, and she was one of the ones who had to supervise me. So it's nice to get to work with you again, Deepika. We're going to bring up Bianca Colhane. She's one of our advanced practice providers. And Bianca works closely with our physicians, our patients, and our extended care team. Yasi Nasi. Yasi is our well-being advisor, and she can speak to what that is like to be that real center support for our members. And Jeannie Lee. Jeannie Lee is a yoga expert and one of our well-being facilitators. So I want to bring these slides back up. It's a lot to absorb. If we go back to the care model, Bianca, maybe you could start and tell the audience a little bit of what it's like to be an advanced practicing provider working with this extended team, a well-being advisor, trying to connect to experts. So if you could take it from here and speak to your role.
Yeah, absolutely. So I'm Bianca. I'm a physician assistant with Blue Zones Health, and thank you all for being here and listening. I'm very blessed to be able to have the opportunity to talk this model through and share my experience. So as most of us have experienced, you walk into the room, you have a typical 3-month diabetic follow-up, right? So you're going in, you have your labs, and you're looking, and you're like, A1C is stable, it's still within goal, right? Less than 7. Cholesterol might be borderline controlled, and you walk in, you're like, hey, how's it going, right? And you know what you want to say. You want to practice those lifestyle behavior changes. So what I used to do was I created all the USPSTF guidelines. I had them on paper. I gave them to them. I was like, please go home and do this if you can. But there never was enough time to create a sustainable goal for them. As my experience was, I didn't know the ITLC groups going on. I didn't have a comfortable relationship with dietitians in the community. So I felt like I wasn't necessarily doing the best I could for these patients. And a lot of times they would come back 3 months later and I'd be like, did you do anything on the education sheet I gave you? And they'd be like, I lost it. I don't know where it is. And I'd be like, honestly, I would have probably lost it too, right? Because how can I get that to stick? How can I bring that to life for these patients? And with this model, for me, over the past year, I've been able to work through it and work really closely with Yasi, and it works. So what this emphasizes is now when I walk into a follow-up visit and I know that this patient needs true behavior changes in lifestyle medicine prescriptions, I say, hey, can I refer you to our well-being advisor? Can we talk about what that looks like? So I have my care plan in place. Yasi is able to see my care plan, and then she's able to reach out to the patient. So she gives them a call, and then that relationship begins to develop, and it flourishes. And the behavior change becomes sustainable because she's meeting the patient where they are right now. And it's the time that I don't necessarily have to give during the visits, but she works as an extension of me. So behind the scenes, all this still gets to continue to happen, and that's where the real positive outcomes come from. So maybe once she develops that relationship and that trust with that patient, she's like, hey, why don't I connect you with a social worker? I already know that this walking group is going on in the community. Do you think you could go to that 3 times a week? That would help your exercise increase. That would help insulin resistance. That'll help you maybe lose some weight. Or, I know Jeannie's awesome. She's part of us. She knows what we stand for. She's got a yoga studio down the road. And it's that community embedment that brings this all to life. Or even right now, the virtual prescription, right? You're socially isolated. Why don't you hop on Zoom? There's other people that are in similar situations. It meets once a week. Can you try that? And that's how this is really brought to life, and I've seen it in my own panel, and it's really amazing. And so this infrastructure really eliminated for me that feeling of having to work in a silo and do it all on my own, because we know that we never have enough time to get in all the things that we want to get in a visit. So really what this highlights is efficient communication, great continuity of care. So every time, despite there being multiple members coming in and meeting the patient, they don't feel like they need to re-explain themselves. They don't need to retell their story. It's continuous, and they're just supported throughout their health journey. And so ultimately, the care team, we have the same shared goals. We have the same shared plan and shared outcomes for this patient. And that I've seen over the past year leads to a natural offloading of the primary care provider, because as they become established, regularly working with a health coach, meeting with the dietitian, working on behavior change in the community, they don't necessarily need to see me as often as when they're unstable and we've got to check in every 2 weeks, every month. That's the difference. And so I want to leave us with a quote that was from a recent patient encounter that I referred to Yasi, and he started doing all of the lifestyle things that we wanted him to do. And I was like, hey, how's it going, right? How do you like talking with Yasi? And he said, I love it, and I trust her. And I kind of want to leave us with that. I trust her. It's really rare to hear that nowadays in patient encounters and talking about medicine, and we've been able to achieve that, and I've seen it. And so on that note, I want to pass it off to Yasi, and she's really the connective tissue in this model for us, and I want her to expand more on her role.
Thank you so much, Bianca. Thank you. Hi, everyone. My name is Yasi. I'm a well-being advisor and one of the health coaches here at Blue Zones Health. And I'm very lucky that I do get to work deeply with patients one-on-one. So as a well-being advisor, my main role is to make sure that each patient's care plan flows smoothly from start to finish. So what does that look like? As you can see on the slide, patients are either referred to us by their doctors, or they self-refer to us through materials they have received because they're Blue Zones Health members, or as Kono mentioned, through community events, or if they were recently hospitalized and they've realized, I need to start making some changes so that I don't end up in the hospital again. So I get the referral, and then I schedule a call with them. And during this call, the most important thing is really for me to build trust with them. And the way you do that is you listen, right? I'm not saying you need to do A, B, C, D, but I listen to see what their problems are, what their issues are, what they're dealing with. So I ask them about their chronic health issues they're having. I ask them about their diets. How many servings of fruits and veggies are you getting a day? How many times a week are you eating fast food? How many sodas are you drinking in a week? How many packaged foods do you eat? I ask them about their physical activity level. Are they sedentary? How many hours are you sitting? I ask them about their sleep habits, which, most people are not getting the quantity and quality of sleep we should be getting. And then these are all, lifestyle behaviors that are important, but what's really important, and I think it gets missed and people don't ask patients, is what's your stress level and anxiety, but what's your outlook on life? Is this patient a positive patient? Do they have a purpose that they're living for? Are they just down and sad? And that's really important to understand, as well as understanding how connected they are to their community. It could be their families, their loved ones. Some people are very isolated from their families. Or their community. Are they connected to their community, or are they socially isolated? And based on all of this information and the back and forth, and mostly listening to the patient, I kind of can get a view of what's going on and areas where I know they need support. But again, I don't tell them, this is what you need to do. I'm going to send you to this person. I really engage them in conversation and see where they're at and what they're willing to do. Because the only thing that'll get done is what they're willing to do, not what I tell them to do, right? So some examples of patient situations, just so to kind of make the whole flow more clear for you. Let's say an elderly patient comes to me, and through our conversation, I realized that there's some food insecurity going on, or she just recently had an injury and she can't get around as much, so she's not moving that much. So I talked to her and I asked her, is it okay if I have a social worker call you and see if there's any help we can offer? And usually the answer is yes, I would love that. And then the social worker can hopefully see if they qualify for meal delivery services or a walker, for example, so that they can actually get out and move more. Another patient might come to me with diabetes, with a new diagnosis, and they really don't know what it is and where to start. So again, I ask them, would you like to join a diabetes group? Are you more a one-on-one person and want to work with a health coach? Would you like to talk to a registered dietitian to learn more about this diagnosis, to see the foods you should be eating, the foods you should be avoiding, other lifestyle habits that you should be changing? And then we have a lot of patients who come to us nowadays with high cholesterol, high blood pressure, A1C is creeping up, they're overweight or obese. And again, I meet the patient where they're at. Are they a one-on-one person and they just want to talk to a health coach to implement changes? Are they kind of isolated and lonely, and would they benefit from one of our group programs, whether it's via Zoom or in person? So you can see with each patient, I really take the time to get to know that one person. It's not one size fits all, right? It's everybody, we meet them where they're at. And we look at the person, the whole person, not just the numbers and, okay, we want to reduce these numbers. Sure, that's great to reduce cholesterol levels and reduce your weight, but we want to look at you as the whole person and enhance your outlook. We want you to have a sense of purpose in life and to have a balance and a happy life. So again, just to reiterate the process, patient is referred. I have an in-depth conversation with them to really get to know them, build that trust and rapport, which is really important because that's when they actually start to engage in our programs. And then I refer them to our experts, our registered dietitians, other health coaches, mindfulness coaches, and our online programs or our programs that are in the community based on that specific patient's needs. And throughout this whole time, I am communicating with the provider. So I am sending reports back, letting them know what's going on with their patient. Are they improving? Are they not? What are some barriers we're facing? And the providers will come back to me. I can see their notes from their visits. I can check the lab numbers and see if we're improving. And what's important is, again, we're improving numbers, but we want to improve the full quality of the patient, right? The life quality for these patients. One other thing that's very unique about our model is that besides having these experts, such as registered dietitians and health coaches to work with patients, we also offer virtual prescriptions and community prescriptions. So what are these? So virtual prescriptions are online groups and classes via Zoom that we offer to all of our members. So some of these examples of these online Zoom classes are, we might have a 6-week program for somebody who recently was diagnosed with diabetes, taught by a registered dietitian to learn more in depth and be surrounded with other people in the group so they can support each other. Another class is called Plant Slant, and this is for patients who want to be eating more plant-based and avoiding meat products, animal products, and avoiding processed foods. So these classes will start with a 10-15-minute lesson. We kind of discuss it, and then the patients go around, each come up with their own health goal for that week. For example, I'm gonna make sure I add 1 serving of beans to my meals this week. And each person will have their own goal. And then they come back next week and they tell us, okay, how did that go? Were you successful? What barriers did you face? And that's group setting, that support setting really helps for some people because there's group accountability, and then they kind of offer advice to each other. And for those who are isolated, this is a form of community that they're lacking. And then the other part that we have is our community prescriptions. So the community prescriptions are similar courses, mindfulness exercises, yoga classes, or even a diabetes group meeting at a senior center. But these are embedded within the neighborhoods where our patients are. And so next I'd like to introduce our wonderful well-being facilitator, Jeannie, and she's gonna share a little bit about our community prescriptions.
Thanks, Yasi. Hello, everyone. My name is Jeannie, and I'm a yoga therapist, and I partner with Blue Zones Health as a well-being facilitator. Everyone, let's all take a deep breath in and out. That's basically what I do, in a nutshell. So you're welcome. So just so you know, public speaking is not my thing, but yoga therapy is. So I am going to rely on notes. But please let me tell you that when I see groups of people come together for the sole purpose of connecting, for the purpose of trying to improve their health and happiness, it's really magical. And that's what community prescriptions are all about. So community prescriptions help bring the convergence model to life. Blue Zones Health partners with Blue Zones LLC to identify these community service providers within the patient neighborhoods, within the radius. Now, if you look at the slide, on the slide you can see how the Blue Zones Health has mapped out these patient hotspots and the surrounding community service providers. For example, one of these providers has a walking group, and this one's called Walking with Ease. This fulfills a prescription to walk 3 times a week, and the patient is motivated and probably makes some new friends along the way as well. So there may also be partners that offer Tai Chi for balance or yoga for relaxation, but this fulfills the prescription. These classes and activities, they really put lifestyle interventions into action. But not only that, they offer social connection and community, which is so critical, yet underestimated here in care plans. What I also appreciate is the thorough vetting process, where community service providers are carefully identified, vetted, and selected to become the preferred providers with Blue Zones Health. It's a win-win for patients and for the community providers. And what's exciting is that the skills and services like mine that patients would normally seek out and pay for on their own, it becomes part of this Blue Zones Health ecosystem. Now, what you don't know is that unlike Yasi, who's employed full-time with Blue Zones Health, I'm an independent contractor. So the patients I work with, they don't know that, but it really doesn't impact their care. The operating model will allow providers like me, which there are many in the community, to join as contractors and to have the ability to grow the client base and also create steadier income, which really we all want, right? Not just me. It'll also allow others like me to collaborate with medical providers in ways that elevate our work, and all of this while maintaining the autonomy. Thank you.
Thank you, Jeannie. It's, you know, some of you I see have had to leave. We're going to be at the booth. There's some things I wanted to talk about. I have a patient at the Loma Linda VA that whenever you'd get him started on anything that you wanted him to do, he'd say, I got a case of the yeah buts. And I feel like whenever I would be sitting in the audience at a presentation like the yeah buts, he's like, you know, like, yeah, but is this really going to get paid for? Like, how do you get all of this to be generating revenue? And it's like, that's the beauty of the scale and the ability to be in the rooms and the ability to have a brand like Blue Zones. We can go to a payer and say, don't you know this works? Don't you know there's an ROI? And there's codes for this. But I remember as an individual practitioner myself, looking through the IPA contract, I didn't know I should be trying to ask for a carve-out. And, this is a bill of, I need to actually ask for money. And even if I did, they'd say, yeah, take the boilerplate. like you're not big enough. We're not giving you extra. We're not going to do an exception for you. But if we come as a collective unit, I mean, this is how independent physician organizations have worked for a long time too, is we need to be able to leverage all of us to be able to get those contracts. You come in, and another thing I wanted to mention too is, this is 27, I can start, if you're in a small town in Idaho, maybe we're not gonna be able to build the entire infrastructure for you in 2026, but we want you to sign up now, because if you and a team of local experts are ready to get going, we can start to build with you to put that on our map so we can get going. We'd like to start right away with virtual resource support and really come together to be able to build out care plans when patients come to us, but it's gonna take an army. It's gonna take a virtual and boots on the ground lifestyle expertise in all of our communities for us to make this work. That said, I do wanna step back because I have Dr. Pandit next to me, who's also been in private practice and now a part of Blue Zones in our centers. And I'm really interested to hear what the model's been like for you transitioning into being part of Blue Zones Health in our centers.
Yeah, sure. Thank you, Kono. Hello, everyone. I'm Deepika Pandit, and as Dr. Badalamenti said, I work at the Blue Zones Health Centers. So we were a private practice before joining Blue Zones Health, and so I'm familiar with a little bit of both systems, and I kind of want to share a bit of the difference. As an independent practice provider, I've had the privilege of being able to spend 30 to 40 minutes per patient. And I'd spend time with people trying to understand, like, what is really going on with your diseases? What are the lifestyle issues that we need to address? And it was really rewarding because I would see them, I'd be able to spend this time, and then I'd refer them to a health coach, a dietitian, exercise coach, or a social worker as needed. And it was very rewarding. There are some of you here who have practiced or are practicing in a similar concierge-style type of model. What I realized was a couple things. There was a couple things missing. One was community resources. Because when I'd sit and talk with patients, and I'd ask myself, what is really the root cause? And I'd realize they're missing community. And that's not something that I can provide in the practice. Even in the 30 to 40 minutes that I spend with them, I'm not able to give them a lot of these things. There are people who didn't have any purpose in life. They were just kind of getting by. They didn't feel like they had meaning or value to add to the world. And this was causing stress, subconscious stress in their body and affecting their chronic diseases. That's not something I could fix or had time to fix. I would see people who are lonely. They had no social support. They had no friends. They had nobody to really care for them and watch out for them. And that wasn't something that I could fix either. That's something that's in a lived environment. Those are people you live with, your family members and your friends, social network. That's something I couldn't fix. And I needed help with something like this. I would see people that I wished I could say, hey, there's a park down the street, and every week there's a group that's meeting there and walking. Would you like to join them? You know, you can go out there and get some fresh air, greenery, have some fun with people around there, and move naturally and heal that way. But there wasn't a group that was available that I could refer people to. I'd have people say, well, if I'm really interested in doing gardening, but I live in a tiny little apartment, there's not much I can do. I wished I could say, actually, there's a community garden that's just around the corner, and I know somebody there. I can refer you to that person, and they'll get you connected with how to get your own garden started. But I didn't have that kind of connection with people. So these were the things that I was discovering was something that was missing from even the concierge type model. The other limitation is that when you're spending, as a provider, 30 to 40 minutes per patient, your panel size you realize has to be small. You can't really grow. And if we are trying to take lifestyle medicine to the masses, if we're trying to get lifestyle medicine to everybody, everywhere, then the question we have to ask ourselves is, can one provider extend their reach to a larger population without the risk of burning out and while still being able to deliver good lifestyle care? Is it possible to do that? And that's what Blue Zones Health is really trying to aim for. So the biggest difference that I've noticed with Blue Zones Health as I've tried to practice this is that now the availability of these lifestyle resources are available at a broader level. There's an entire network now of experts that we're trying to build with you all. And these are experts who used to be practicing with me, who are now available to a larger population and to a larger base even of providers. So they are available in the network and compensated by the network instead of my practice compensating them. And this does make a difference. Even for community resources, this is available. So as lifestyle resources through experts, you can refer to prescriptions with an expert. There are community prescriptions that you can also send patients to. And these community prescriptions are vetted, like Jeannie, It's hard as a lifestyle medicine provider, an individual provider, to create those connections. You don't have the time, you don't have the resources, the staff, to be able to go out there and create these connections. And people have asked me, how do I want to bring this to my community, how do I do this? And so now with Blue Zone's help, we're creating the system where we can do that. This changes things for patients, it changes things for us as providers, and it changes things for our practice. What this does for patients particularly is that they can still get good lifestyle care. It's just outside of your clinic, and now it is actually through a care team. It's not just you, and it's not just your MA that's doing it. They get consistency. We know that one of the key elements of being able to be successful in lifestyle medicine for patients, they need consistent, supportive relationships. That takes time and energy as well. And now they can get that because you're not having to spend as much time to create that consistent relationship over a long period of time. The well-being advisor is suited to do that, just like Yasi. She'd be the one that would be connecting patients and checking in with them. Patients also have access to these community resources that now they didn't have before. So this is the difference for patients. Difference for providers is that I no longer have to be the main touch point in a patient's journey. I can start the lifestyle process. Okay, let's create maybe 1 or 2 SMART goals within the few minutes that I have with you here. And then I can do a warm handoff to the well-being advisor. And it's a warm handoff because I know Yasi. I can say, I know this person. Let me refer you to this person that I'm well aware of, and she's gonna guide you through the next steps and get you connected with the other resources that you will need. Then I can schedule a follow-up later than I normally would because I know that there's care being given in between appointments now. There's lifestyle care and there's regular check-ins that Yasi would be doing with my patients. And I'll be kept in the loop, as she mentioned. So I will be getting regular care plans. This is done under my supervision. Progress notes will be sent to me, and if there's any issues or concerns, then there is access to be able to fix those things. What I can do during the follow-up appointments is now I can focus on the high-value clinical decision-making. And I can also focus on deprescribing if I need to. So if people are starting to come back from the well-being services team and saying, hey, I'm actually getting better. My blood pressure's getting better, my sugars are getting better. Now I'm focusing on deprescribing. And I can continue to be the cheerleader for my patient. So over time, these well-being services, this team functions as an extension of myself and my clinic. It's not just that I'm referring to another services, I'm saying I'm gonna connect you with our care team. It's just an extension of me. What this does for our practices, financially, we're all interested in financially, right? So financially, this is able to free up from some provider space. Because the time, if you're practicing seeing 30 to 4 minutes per patient, now you don't have to do as much of the lifestyle services because the well-being services team takes that on. And so this frees up some of your space, which is valuable. Provider time is valuable. So what do you do with that time? You can either focus on growth if you'd like to grow your panel. You can also focus on the patients that really need more clinical care that the well-being services team may not be able to take care of. These patients who are highly complex, high risk for hospitalization, they need a little more clinical check-ins. You can see them longer and more frequently. Or you can focus on growth as well for your clinic. There's less expenses. So there's less administration of the experts. Since these experts are no longer paid by the clinic, they're with Blue Zone's Health, then there's less expenses on the clinic as well. And there's less use of the in-house staff because I'm no longer having my MAs check in with patients as frequently as I would before. The other thing that this does, which I love about this model.
I know we're kind of at the end of our hour. I took too much time, I knew I would. Dun, 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 dun. We'll have time at the booth. If you guys want, if you can stay, we'll talk a little bit longer, but I know we want to be respectful of everybody's time. The QR code is on your seats on the back of your handouts. It's on the screen. Please join us. Join us on this adventure. Let's obtain this Holy Grail together. We're really grateful for all of your time today. Thanks for coming. We're at the booth, the Blue Zones booth. Stop by, talk to us. If there's questions you still have saying, I mean, I kind of get it, but I need to know more, come, we'll talk about it more. We're here for the next couple of days. We're at the Blue Zones booth. It's great to have you all. Thanks for coming.